With school less than a month away, infectious disease pediatrician Dr. Jeffrey Pernica joins us now from McMaster Children's Hospital with more on vaccinations among young people. Good morning to you.
Morning, how are you?
Very well, thank you. First of all, let's talk about how important it is for children to get back in class. It's probably healthy for all families.
Oh, I think that's right. I mean, the benefits associated with in-person school are really legion. I mean, there's the educational part of it, which is obviously extremely important, but there's so much more, right? There's the physical health aspect, there's the social and emotional health aspect. There's so many things about attending school that make our children healthier and happier that I am very excited to know that they'll finally be getting back to school in the fall.
Getting back to a structure and a routine, and it's just healthy, and it's probably really good for moms and dads too.
Yeah, I think that's true, but really, I mean, the real impetus for them to go back to school is so that they can be who they want to be. I mean, there are just so many things associated with being in school that it's really more than making things convenient for the parents. It's about our kids being as healthy and successful as is possible.
Right, growing into their own people. Do you have any idea at the moment what percentage of children 12 and older who are vaccinated right now in our community?
So the Institute for Clinical and Evaluative Sciences from Ontario does publish this data. It's a couple of weeks old, so I don't have as of this morning information, but certainly from the end of July, it appeared as though about 2/3 of younger teenagers had had at least one dose. Now, fewer than that have had 2 doses, and it does vary by postal code. So different areas of Hamilton will have different rates. There has been a push, though, to get more of these teenagers fully vaccinated, which I think is a great idea, given that we know that the Delta variant, spreads a lot easier than previous variants or the original COVID-19. And while 2 doses of mRNA vaccine are still quite effective against Delta, 1 dose is not quite as good.
Because we're hearing that this is a virus that almost sheds as easily as chickenpox do. And if you've ever had anybody with chickenpox, you know how contagious that is.
Yeah, it's certainly more transmissible than the previous. And so it is certainly possible that we'll see more cases go up in the fall. I mean, a lot of people talk about safety, and I think safety is important. I think we should do what is safest for our children. The thing that I say now and have said before, that safety is not just about not catching COVID. It's about our children being as healthy as possible. And so we really need to pay attention to what is going on with them. Going back to school, is, I think, the safest choice for our children, because there are so many things, there's so many benefits that school brings, that this is the way that they are truly going to be the healthiest when they're able to.
Sorry, go ahead.
Oh, I was just going to say that there's the educational aspect, but the physical activity aspect, whether it's just getting to school, gym class, or extracurriculars. There's all the other things that are part of school, whether it's extracurricular, athletics or activities or what have you. And we shouldn't minimize the emotional dimensions of going to school. If you talk to my adolescent medicine colleagues and my psychiatry colleagues, they will tell you that there was an explosion of mental health disorders, whether it's admissions for eating disorders, anxiety, mood disorders. Getting them back to school is the healthiest choice for our children.
That's what I was just going to talk about, the mental health now. Now, what about for parents who are hesitant? What are some tips for parents and the child thinking about getting vaccinated, or maybe thinking about not getting vaccinated?
That's a great question. Now, vaccine hesitancy is not one thing, right? And there's no one size fits all. It's really about different concerns to different people. I would say that most people who haven't gotten a vaccine, don't have a vaccine because, it is not easy for them to do so. It's hard for people to take time in the middle of the day. A lot of people don't have ready transport to places where they're being vaccinated. I think the city of Hamilton has done a good job of trying to address these kinds of concerns. And if you go to the City of Hamilton website, if you Google "Get a Vaccine Hamilton," you'll see that there are a number of clinics and possibilities to get a vaccine, whether it's mass vaccination clinics. First Ontario is running till the end of August, as is St. Joe's. There are primary care vaccination clinics that are doing this. There are mobile vaccination clinics that are going across the city. And there's a number of pharmacies that do offer mRNA vaccines to teenagers. So hopefully one of these will be within the reach of most of our citizens. And a lot of these are also open on evenings and weekends because that's easy. There are also a lot of people who don't have a vaccine because they're worried about the needle part. And the COVID vaccine, like all the other vaccines that we have, is a needle. This is not something to be laughed at. This is not just a problem for young children because it interferes with universal immunization. What I would say to both lay people and care providers is that there's a number of evidence-based resources to deal with this. And so, again, healthcare providers and lay people can look up these things. There's good information at Immunize Canada website or Kids Health First website, which is put out by the Ontario COVID-19 Vaccine Table, that talks about ways to deal with needle phobia, vaccine anxiety, things like that. And then finally, I think there are a lot of people worried about side effects of vaccines. And what I would say to them is that vaccines are just about the safest medical intervention that they will ever get from their physician. Safer than antibiotics, safer than most medicines, safer than surgeries. And we know to this point, there have been hundreds of millions of people vaccinated across the world in various jurisdictions. So I think we do have a pretty good idea of the side effect profile related or associated with these vaccines. And I would happily say that vaccination is probably the right choice for the majority of Canadian teenagers.
Okay, Dr. Jeffrey Pernica from McMaster Children's Hospital, thanks so much. And we're going to get a link to all those websites that you mentioned. We'll get that in our website, chch.com. Thank you.
Thank you so much for having me.